Good afternoon, everyone. Welcome to the September edition of our monthly Community Engagement Spotlight Series. My name is Tobi Cawthra, and I'm a program coordinator in the Office of Community Engagement at MCW. Please note that this session is being recorded, and please be sure you are muted throughout the presentation. I'd like to begin with a statement from the Office of Community Engagement. We wish to acknowledge the Indigenous people who are past and present stewards of the land on which we pursue our just cause of a healthy community for everyone. We encourage everyone to use the chat to share comments or pose questions for our guests at any time throughout the session. This monthly series features community partners and the important work that they are doing. We highlight their goals, motivations, and accomplishments and the ways they have partnered with people and programs at MCW. At this time, I would like to introduce Sarah O'Connor, Program Director in the Office of Community Engagement, who will say a few words about our featured guest today. Sarah?
Thank you, Kelsey. I'm pleased to introduce Helen Hermus as our featured guest. Ms. Hermus is the Executive Director of the Milwaukee Consortium for Hmong Health, a nonprofit organization that is dedicated to improving the health and well-being of the Hmong and broader Southeast Asian American community. A former public health nurse and community development worker, Helen leads the consortium where she combines her community organizing experience with nursing to help build health equity for the Southeast Asian population of Milwaukee. Thank you, Helen, for being our featured guest today. I'd also like to welcome today's facilitator, Tobi Cawthra. Tobi is a program director for the Community and Cancer Science Network, the CCSN, at the Medical College of Wisconsin. The CCSN uses a transdisciplinary approach to bring together researchers, healthcare providers, and community members to understand and address cancer disparities in Wisconsin. Tobi, thank you for serving as our Spotlight facilitator. I now turn it over to you.
Thank you so much, Sarah. I'm so pleased to have Helen Hermus here today to share more about the Milwaukee Consortium for Hmong Health. They have been a great partner to us in so many areas. So Helen, I'd like to now turn it over to you.
So we're going to start with a little PowerPoint presentation just so you know a little bit more about the consortium. Our mission is promoting health through education and advocacy. And our goal is primarily prevention of disease, particularly cancer, and or any other injury before it ever occurs. Next slide. So our beginnings, we were founded in 2008 when local practitioners and some researchers noted that Hmong women had higher rates of mortality after breast and cervical cancer diagnoses. They kind of tried to get to the root of the matter, and they came up with some of the reasons why Hmong women tend to be modest, not necessarily wanting to have a clinical breast exam or a mammogram or even a speculum exam to test for cervical cancer. There's also a thought process in the Hmong community that if you don't have symptoms, you don't go to the doctor because you don't have anything to worry about. Some people just aren't aware of the need for preventative care. And another big component is that men are often the health decision makers for the family. So sometimes they might not want their family members to have some of the preventative care. Next slide, please. So what we do is we do a lot of community organizing to try to get people interested in doing cancer screenings, blood pressure and blood glucose screenings as well. And we use community health workers primarily to connect to the communities. They are lay health educators. There aren't any education requirements, but they need to have like really deep connection to the community, a willingness to learn about medical jargon, and being able to really understand what a conversation is between a provider and the client or the patient. And they also should be outgoing and non-judgmental. They need to hold confidences because our communities are very small and you can't be talking about other people to some of the people in your community because we are bound by HIPAA the same as anybody else's. And the people are also, our community health workers are also really good advocates for the community. There are some special training programs for community health workers. We usually use the Milwaukee Area Health Education Center. You may know that as AHEC, and some of you may also be familiar with AHEC as being the people who provide CHIP interns during the summertime for educational experiences with your organization. Wisconsin Association for Free and Charitable Clinics also have a community health worker training program. Next slide, please. So what our community health workers do is we like to say they educate, navigate, and advocate. In particular, when people are needing a medical appointment, our community health workers tend to be the people that are making appointments for them. They either don't speak English or are very conscious about feeling that they don't have good English communication skills. So we will make those appointments for them. We tend to be the go-between primary providers and the clients. We reconfirm their appointments, and if appointment day is there and the patient doesn't have any transportation to get to their appointment, we will transport them for them. The community health worker will pick them up, bring them to their appointment, and usually they are the people that are going to the appointments want the community health worker to come with them because they are so trusted. The community health workers will request professional interpreters to be present. Some of our people that we work with have, there aren't a lot of interpreters that speak that language. So oftentimes our community health worker ends up being the interpreter as well as the advocate for the client. One of the really big things that we do, if we do have somebody who is a professional interpreter, is the language between the interpreter and the doctor tends to be a little bit higher level. So it's our community health workers are able to put some of the explanations into like a little bit simpler language so that the client will understand it. And the other thing that I think is really incredible that our community health workers do is they get calls at all times of the day. I know since I've been here, one of the community health workers got a call at 8 o'clock at night because they were going to be bringing their mother to the hospital and they wanted her to be present so that she could be their advocate for them. There have been other situations when maybe a family has small children at home and there's a married couple, one of them has to stay overnight in the hospital and they're afraid to stay alone. So our community health workers have also stayed overnight in the hospital with them. So like I said, they're really dedicated to their communities. Next slide, please. So where we are now, this is a little bit more about how we began. We started with one part-time community health worker. Now we have four full-time employees and one part-time employee. And we started with a grant from the Wisconsin Well Woman program because if you remember our initial impetus for being started was breast and cervical cancer. So Well Woman program was generous to give us a start. And the board of directors and the part-time community health worker used community-based participatory research to develop an education program that involved educating families and not just the women, because we already talked about how important a male is in making the decisions for the family related to health. So once they had the curriculum developed, she began doing outreach at different churches or any place that Hmong people gathered, churches, the Hmong Market, the Hmong American Friendship Association, and also working with doctors who saw a particularly high amount of Hmong families. Next slide, please. So in order to talk about where we are now, we need to talk a little bit about where the Southeast Asian immigrant history in Milwaukee. The first wave of Hmong and Lao immigrants came in the late 1960s and early 1970s. The second wave came in the 1980s. A lot of the people who came, like 40 years ago, they now have children who are old enough and can help them navigate the medical system in the same way that we do. Some people still request our help, and we are happy to give it to them. But where we are doing most of our community health worker work now is within the Myanmar and like the Burmese communities that the refugees that have arrived from there, and they began arriving in 2000 to 2010. Next slide, please. So this is a breakdown of who we are serving. So about 17% of our clientele is Hmong, about 13% is Karenni, and about 22% is Karen, and 9% are Laotian. Then the rest is made up of Burmese, Rohingya, Chin, Kachin, Black, Hispanic, and anybody else. The unknowns that are in this graph are people that just did not indicate on their intake papers what ethnicity they were part of. Next slide, please. So how we attract people to us is we do a lot of outreach. We attend 15 community events throughout the summer. And at those events, we pull people and educate them on breast and cervical cancer or anything else that they might be interested in learning about, and make sure that they're up to date on their health screenings. And if they are not up to date, we give them calls to come to our weekend health screening sessions, and or just get them hooked up to care however we can do it. We also have a very active Facebook page. That is where a lot of people have told us that they like to get their information from. So we post a lot of information on there with upcoming events, thank yous to our sponsors, and special days like I'm sure that in October, there will be something quite a bit about breast cancer on there as well. Next slide, please. And so what we do to really make an impact in the Southeast Asian community is on the second Saturday of each month, we hold education and screening events. Our education events are usually centered around healthy eating and active living, but we sometimes bring in guest speakers who might talk about mental health or financial wellness, just things that people need to learn a little bit, have expressed wanting to learn more about. And then we also provide screenings at every event. We always provide blood pressure and blood glucose screenings. Thank you so much to APAMSA who comes in and does that for us at every time we request them to. We're very grateful for their assistance. And then we also do clinical breast exams through the let me get that.
Nurses Affecting Change. Helen?
What?
Was that Nurses Affecting Change?
Yes, yes, Nurses Affecting Change. And then we're very grateful to Melanie Burns for hooking us up with Nurses Affecting Change to do that. And then she also is able to get us a phlebotomist from Freighter to come and do testing for PSA for prostate cancer. And then we also get the mammo coach from Ascension to come and do mammograms at least 3 times a year. We are hoping to embark on a colorectal screening program because we work with a group of cancer survivors. We have 15 people in that group, and of those 15 people, 3 of them have colorectal cancer. So we think that that is something that we really need to emphasize and start testing for. This is like one of the flyers that we use to show what we're going to be doing on the weekend. It's already passed, this event is passed, but we had free health screenings at our Community Health and Resource Fair on September 14th. So we try to make things fun for people so they want to come. Next slide, please. And the other thing I think that is really important that we do is we don't just help people with making medical appointments and going to medical appointments, but we reduce health disparities in other ways, like by working with the social determinants, working to improve their social determinants of health. We navigate our clients to social services quite frequently, probably even more than medical care, giving them help to get enrolled in Badger Care, food shares, maybe the marketplace if they have higher incomes, Social Security disability, Social Security retirement, Every summer we work with Feeding America to get senior food vouchers, and then also if people need to get green cards or citizenship, we also help them arrange. We hook them up with people who can do this. These are not things we do ourselves, but we have contacts with people who do things. So from July 1st of 2023 to June 30th of 2024, we provided 3,272 navigations, which include health and social services. We serve about 600 unique individuals. And of those, so you can kind of see like how trusted our community health workers are, that people continue to come back to us for help in getting done what they need to have done. Next slide. Yep, I thought that was it. Does anybody have any questions on this portion, or do we just want to move into the question portion?
You can put questions in the chat if you would like, or you can go ahead and come off mute and ask them if you would prefer. Or maybe if I ask Helen some questions, maybe those that are percolating for you will solidify, or you'll think of something else. So Helen, thank you so much for providing that great grounding of all the amazing work that the Milwaukee Consortium for Hmong Health does. I was curious, could you talk about which communities you have community health workers, or maybe what what areas they serve, and maybe plans for the future?
Okay, so we currently have, some of you may know her, Maria Che. She speaks Karenni, a little bit of Quran, and Burmese. So she, you saw the percent of Karenni that we have. She does a really magnificent job with that. We have Janu Marin, who works with the Burmese and is working a little bit with Quran now, because we lost our Quran community health workers. So we are recruiting, and hopefully we will have someone soon. And then my Huamua, who you probably all know, she left us in February, which is when I came on board, so I haven't been here that long, but she is doing very well right now, and she is excited to come back and help us with being a community health worker for the Hmong people.
That's wonderful. So is everyone situated in the Metro Milwaukee area?
Yes, yes.
Excellent. So a question came up. There are several questions in the chat. There's curious whether, how, or the Milwaukee Consortium for Hmong Health connects with similar neighbors in Dane County or other parts of Wisconsin.
We have not had a lot of connection with other people so far. I know that that is kind of one of the things that we're working to do, and we are working with one of the Medicaid providers who will hopefully get us hooked up with some people in places outside of the Milwaukee area who need to have like their annual screenings done. And these are particularly Hmong people, and my Hua and I were actually just talking about it yesterday, and she is more than happy to go out and help us do that.
Excellent. And what is your favorite part of what you do at the consortium?
I would say just like, I've always kind of been a people person, so I really enjoy connecting with people. I am thrilled to be working with the team that I am working with. I am thrilled to be able to use my nursing degree in working in this capacity. It's not necessarily a requirement of having this position, but it certainly, I think, makes things a lot easier, and made our transition a lot easier because there was some medical knowledge that I already had.
Fantastic. Yeah, what drew you to your role in the for the consortium?
So Part of it was about being in the right place at the right time, and then just being able to have that community contact. I worked with the Southeast Asian population before. I was a Main Street manager for the Milwaukee Main Street program, which was in the early 2005 to 2008. And I worked on National Avenue, which is known as the Silver City District, and there are a lot of Asian-owned businesses there. So that's when I first started working with Southeast Asian populations. So this helps me to be able to combine my nursing with community development, which are kind of the two favorite jobs that I've ever had.
Fantastic. Another question in the chat. What strategies have you noticed have been most effective at recruiting, encouraging individuals to undergo preventative screenings? That's a great question.
It is a great question. I think it's just having the person in the community that they trust and that can convince them that, you know, using Eastern medicine is good, but Western medicine also has a lot to contribute as far as like needing to get the preventative screenings and things like that. It's just having that person that people trust, really.
Excellent. I think that really touches on some of the other questions that that I had been thinking of too, is like how you build those relationships with the community. What have you found to be particularly effective, and or even maybe what people should try to avoid against?
So I think the thing that helped me build relationships the most in the community, being kind of an outsider, has been, I'm a returned Peace Corps volunteer. I served in Poland in the 1990s. And so just having lived abroad makes me know like that I need to simplify my language. I need to bring my language down to, not to talk down to, but bring my language down to the level that I would speak with it, like, you know, like an 8-year-old or a 10-year-old with, so that the language is simple, the words are simple, the sentence structures are simple, and then also to speak a little bit slower. So when I was in the Peace Corps, I lived with a family who had children, and that was how I learned how to speak Polish a little bit.
Fantastic. What has it been like for you to partner with MCW?
We are very appreciative of MCW and all of the partnerships that we've built with different areas of MCW. We absolutely love APAMSA, and Melanie Burns has been super helpful for us as well in getting the people that we need to help us with our screenings, because that is really the bread and butter of what we do. We are developing a relationship with Dr. Seidel from the Menominee Falls Family Medicine Residency, and we're hoping that they can start bringing some residents here for our weekend screening events, that we can they can get their community health experience, and we can offer a few more services to our clients that are coming here. Dr. Mascari, Dr. Colbeck, Tricia Monroe from Behavioral Health have been outstanding as far as being partners as well. And we are embarking on a new relationship with Dr. Jasty and his team with their Advancing Healthy Wisconsin grant to build a culturally sensitive bystander CPR program to teach Hmong people how to do CPR and get them interested in it.
Wow,
So-
Helen, I've talked to you how many times, and I had no idea about all of those relationships. That's fantastic. Oh, good. More questions in the chat. Are you looking for organizational partners, or maybe what opportunities are there for organizations to partner with you on your amazing work?
I think we're pretty health centered right now. We've talked about doing a program where we might possibly get like Asian teens, Asian young adults interested in the medical field, and doing kind of like a workforce development thing. That's kind of just in the talkative stages. So it would be great to have a partner if we want to, if we decide to proceed with that. Anybody that is willing to help us do any of our screenings, like these are the screenings we're focusing on, but there are plenty of other cancer screenings that we can do. We've done skin cancer screenings in the past, oral cancer checks, and you know, if we could get like solid partners that are willing to help us with that on a regular basis, that would be great. If you have any ideas, we are happy to hear them.
Excellent. There was a question in the chat about what about the sustainability for your work? How do you go about considering sustainability and the long-term goals of the consortium?
So that is something that we think about, and kind of like what I said in the slide presentation is that some of our like the Hmong people don't need our help as much anymore, right? That's why only 20% of our population is Hmong, but we found like that the new immigrants really need us. So I think there will always be immigrants and refugees that are going to need our help. So that is one thing that solidifies our sustainability. Eventually, I think that the Myanmar immigrants are probably going to also probably not need our help. So we do kind of need to keep reinventing ourselves. We've also talked about working more with like the Hispanic population, and also possibly exploring to see if the African American population needs are a little bit more of the community navigation that we do. So that's kind of more of our long-term thinking. Right now, we don't have a strategic plan. We are working on making one. When I first came, we did a 1-year strategic plan, and we're going to be working on developing a 3- and a 5-year.
That's fantastic. Is that how you're thinking about how you move ahead and make the changes that you need to make, is through that strategic planning process?
Yes. Yep.
Excellent. Outside of the formal partnerships, are there volunteer opportunities that maybe individuals could get involved in?
Yes. Anyone with a medical background, we are always going to welcome you because there's new education programs that we need developed, new brochures that we need developed, and anybody who's interested in helping us with that, we would very much appreciate it. Our events, we have 2 really big events. One is our fall health fair that I had the flyer about in my presentation. And then in spring, in April, we have a conference where there's about 140 people that come there, and then we require a lot of volunteers to do interpretation, and then just running the whole childcare and just running the whole event. So we usually use about 90 volunteers there. So we are very happy to have volunteers for that event. And if anybody has any other special skills that they are willing to bring to us, we are very happy to hear it, especially if somebody's interested in learning how to be a community health worker and working in their particular community. That would be really amazing.
Great. Your spring conference, is that, what is the focus of that, or does that change every year?
So it remains on cancer prevention, and then any other topic that we identify as being important in the Southeast Asian community. This year, one of the things that one of our younger community health workers said is we have to have something, we have to have somebody who's talking about mental health and how parents should accept what their children are doing, like, because they're not, you know, it's the intersection of the old lifestyle and the new lifestyle, and they just kind of wanted somebody to be there to like talk about how to navigate that.
Great. Are you noticing themes of needs or wants in the community, and maybe what those might be?
I think that food security is a big thing. That is why when we have our events, we try to do things that give food away. You may have noticed, like on our stage, we had all of those bags. Those are filled with fruit, and they were our centerpieces on our table at our conference. And that's just to kind of help out a little bit. With our cancer, any anytime we have a event here, we always have food, like for our weekend screening sessions, we always have food for our, yeah, we're big on the food thing and we try to make it healthy. And then, you know, Asian hate is still very alive. So I think that is one of the other things that people struggle with, like maybe want to like stay in their home more and like kind of an isolation thing.
It's too bad. Is that something that you talk about at your conferences, or is that something that's you're hearing about more when people are just coming in for screenings and the intersections or the inner conversations with the community health workers?
It's conversations with the community health workers. Like they will, like if they go somewhere for lunch that isn't Asian, like they will come back and talk about like something that happened to them when they were out there. And I'm actually really pretty shocked. So, yeah, I feel myself being very mama bearish. Like, who did it? Who said that?
For those who are not currently involved with your organization or with the Hmong or the Southeast Asian community, how do you, would you recommend people engaging in the community?
I think they're depending on like what their focus of what they're interested in engaging in. Like there are certain, like in the Hmong community, there are certainly different organizations that can help with like whatever your focus is, like HALO works with sexual assault and domestic violence. And then there's Hmong Friendship Association that has a whole plethora of things that they help people with. Just, you know, figuring out who you want to, like what you are looking to accomplish, I think is a really good place to start. And then to engage with that, like usually there's an organization, or if they can't help you, they can refer you to who can help you. And then as far as like some of the Myanmar refugees, I think it might be a little bit more difficult because they are a little bit more insular. They don't have like the network that the Hmong people have developed because they're a little bit smaller communities. Like the Karenni community, there's probably about 100 there are probably about 100 families in the Milwaukee area. So that's actually a really small community. But if anybody's interested in connecting with anyone, we would be happy to help anybody connect with them.
Fantastic. Another question that came in the chat and really kind of feeds off of what we were just talking about is that the Southeastern Asian communities are still somewhat isolated. How do you break those barriers and build trust within the different communities that you serve?
I think as long as they know that you're looking to help them, I think that that's like the really big thing. Like that was one of my questions when I interviewed, like, how are people going to accept me not being Asian? And my WHO has said, as long as you want to help them, you will be accepted. So they sense that you want to help them, and different, yeah, they just, there's just, you know, senses.
And what advice do you have for socially integrating and engaging the different sections of society? That's a big question.
That is a big question. I don't know if you're thinking specifically with our organization or in general, but I think the more that people learn about other cultures is really important. Whether it's the food, whether it's the cultural, like we have a lot of discussions about culture, like what do you do in your culture? What do you do in your culture? And it's, I think the more often that you can have those kind of discussions, that helps to kind of make communities work together more. And I think I don't know what on a big scale can be done, which is I said that I was a Peace Corps volunteer. So we have this returned Peace Corps volunteer group, and I just feel like it's like just so natural for all of us to like go out and want to like meet people who've been in other countries or who are from other countries. And I guess, you know, that is like one of the things that we bring back from Peace Corps is being like the third world goal. And I wish that more people had the ability to experience something like that, because I think it would make the world a better place.
Yeah, so really understanding those different maybe social or cultural norms, and maybe where that common space is, and probably breaking down maybe where misunderstanding sits. So, excuse me. So for people who've listened to your presentation today, what would you want if for anyone that's listening, like say, what do you want people to walk away with? Maybe one or two takeaways.
I think, I'm not sure exactly who the whole audience is, but I know that a lot of it is Medical College of Wisconsin. So I am assuming that a lot of people are involved in healthcare and working with patients. So I think one of the things, or research, so one of the things I would really want people to know is to ask them to recognize the health disparities that the Southeast Asian community has. Because when you look at data of like health disparities, Asians actually don't look that bad on paper, but that's because they're aggregating all of the different areas. They're aggregating South Asia, Southeast Asia, Pacific Islanders. And when you pull them apart, when you disaggregate the data, you see that the Pacific Islanders tend to be some of the healthiest people in the world, but yet the Southeast Asians, their health disparities are very similar to any other BIPOC community in the United States. They've got the high blood pressure, they've got the high incidence of diabetes, cancer, you know, it's just, they're just all very, very similar. So the other thing regarding health of like the Southeast Asian population is there really needs to be a lot more clinical trials. So if you are working with perhaps a cancer patient and you have a new clinical trial, it would be great if you could maybe start inviting Asians to participate in that. There might be a language barrier, but I think in order to get that data, I think it's really important. And if you need help in trying to connect with somebody who's maybe like, no, I don't want to do it, you can always refer to like a community health worker or somebody who's from that community to maybe help convince them that that would be a really great thing for them to do. And then, yeah, when you're doing research, if you can disaggregate the Southeast Asians from everybody else, that'd be great too.
Good. There was another question that got added into the chat. Are there systems or sectors or even specific organizations that you would like to engage with? And maybe people here can help you make those connections.
I would, yeah. I think a lot of it's going to depend on where we go with our strategic plan. I know the partners that we have now that we really appreciate working with. There's financially, I think there's a lot of financial education that I think our community health workers need as well as our clients need. So I'd love to engage with somebody who knows a lot about financial, like who can teach finances at a very basic level, like even, you know, interest on a credit card versus paying it off each month, just simple things like that. That is one area that I would like to work with. And I don't know, I hadn't really thought about that much, but that's like one of our areas. We are interested in talking a little bit more and learning a little bit more and developing more of a program with mental health. The only problem is we don't have the skills to do that. We have been working with the behavioral health division, and they've been helping us a little bit, but that is just not where we can go, because when you think about the trauma that people who've lived in a refugee camp for an average of 17 years has, taken away from their home, taken away from their country, and just stuck somewhere and then shipped somewhere else. Like, that's a lot of trauma, and they need help getting through some of that. And then there's still, I kind of talked about it before, like the people, the people that the old generation and the new generation, and having them understand each other.
Great. Excuse me. I think we talked about, how people could support you and your community, and you were so welcoming to have people join in. And I noticed in the chat there were some people that were interested in connecting with you. And so we should probably even go back to your business card before we get done today, because I think they probably would want to connect in with you. There was another question about how you approach and address sensitive topics like mental health or sex education.
Oh, that's tough. I would have to say we probably don't address that as much as we should. We did take a first aid mental health training with Dr. Kolbeck, so I don't know that anybody has actually been able to use that yet, but we certainly have that in our back pocket if we need to use it. Yeah, I don't think we don't, I think the problem is we don't really know how to address it, so we don't. As far as sexual education, I think, was that the question? We certainly don't talk to men and women at the same time about that. We kind of separate that out. And what happens with a lot of the Myanmar refugees is, I don't know about Hmong or not, but the Myanmar refugees, like, a lot of times they don't even have words to describe like a uterus or ovaries. I don't know which ones they don't have words for, but it makes it really difficult for them to talk about it. I think just the trust that our community health workers have in their community helps them to be able to have that conversation with women. I think we aren't able to have that conversation with men because that would probably not be culturally okay to do that.
Sure. Within your patient population, have you noticed that the younger people within the Southeastern Asian community are involved as well within being educated?
Could you please?
So within your patient population, have you noticed that the younger people maybe, I wonder if they're saying they are involved in education, or are you educating the younger members of the community also?
We have not made a focus on youth. We've really focused on the people who are eligible for breast and cervical cancer screenings. So like 35 and up is usually who we are focused on. But like I kind of talked about before, we're kind of hoping to maybe develop like a program where we can involve youth in teaching, like getting their parents to go get their screenings, and then maybe getting them to be interested in being community health workers themselves, to kind of help build that community health workforce, or even nurses or doctors or wherever, just to get into the community, just to get into the health field.
Excellent. And how do you continuously learn from the community you're serving and remain culturally humble?
Just participating as much as I can, like getting to know people and asking our community health workers, I have a lot of crazy ideas, right? And I know like other organizations that I've worked with, they have worked, and I don't know if they're going to be working with our population that we're working with. So I always have to run things like that past our community health workers to see if they think it's like, and they're honest. They're like, no, that's not going to go. Or yeah, let's try that. We'll see. We've never done that, but let's see what happens. So, yeah, that's, but I think, yeah, just trying to participate, reading, although reading doesn't really do as much as like, I think really talking about it, because you can ask questions and have a good conversation about differences. So, yeah, just trying to participate in the different communities.
Do you survey your communities at all, the people that you serve, about maybe topics or things that they might be interested in?
We have not done that for quite a while. We are kind of identifying where we think we need to be at this point. When we start doing our strategic plan, we'll start doing some focus groups and then get a better idea of what people from the community are wanting us to do.
And when do you think you'll be working on your plan? Or when do you hope to have it done is maybe what I should be asking.
I think we're planning on it taking at least a year, so we're probably not going to start till like January of next year, so it'll take a while to get that accomplished.
Yeah, they are large undertakings.
Mm-hmm.
Well, I think, there's probably lots of people here too who as you're expanding, that they'll be interested in jumping in and being a part of the work that you're doing. Actually, let's talk again just about how people can connect with you, and what would be the best way for all the people who are interested in volunteering or collaborating with you. What is the best way to get a hold of you?
Probably the best way is by email. And I can, let me see if I can get into the chat. I can put my information in there.
I think that would be great, because I know if we went past that, your business card, which is so smart to include, I know that they'll want to, anyone missed it. And I think, one thing that I've just been curious, because now, I know you've only been really with the organization for, not even 6 months. But if you were to say, let's say 10 years from now, what would you like the organization to look like?
I think it would be amazing. This is my nurse background speaking. If we could have a clinic where we just, like, we have more than just our Saturday screenings, where we're able to do that we'd be able to employ a nurse practitioner or physician's assistant or medical doctor to see people and just be open on a daily basis for people, and not just serving like the Southeast Asian community, but anybody who needs our help.
That's what a great vision. And another question came through the chat. How does the consortium create a bi-directional relationship with the community? Example, how does the consortium engage with the community, and how much does the community engage back with the consortium? Are there ways for the community to inform or direct your work?
Whatever they discuss with the community health workers, that would be like the way that it comes back to us. Or if they, like, at some of our events, we might just go up to them and ask them what they think of it, or afterwards what they thought of it, and what other things would you like to see. But I would have to say the bi-directional, maybe we need a little bit more work on that. Like just finding out what they are more interested in.
Is it do you have a board of directors too, right?
Yes.
They're probably, and I'm sure they're they're adding in. Are they all community members?
As far as Southeast Asian, we have 3 white board members and 3 Southeast Asian board members. Because the 2 of the board members were the two of the white founding members were on since the beginning, and they were the researchers and the practitioners that realized that Hmong women had such a higher mortality rate. So they've remained, I mean, they've been involved for 16 years, so it's pretty incredible.
That's an amazing commitment. So is there anything that else that you think we should know today?
So I asked Maria what she thought I should cover. And one of the things that I forgot to say earlier was this is kind of directed at the practitioners to remember that when you are working with Southeast Asian people, that their communities are very small. And if they have a bad experience, everybody in the community is going to know, and they are probably not going to come back to you. No, none of them. However, if you are really good and they really enjoyed their time with you and they think you're a great doctor, you might have to stop accepting new patients because they'll all go to you.
It's good to know.
Word of mouth is very strong for them.
Yeah, that's fantastic. Do you feel like for the most part, people are having positive experiences and that their providers are culturally knowledgeable, or do you think that there's gaps there?
I think there are gaps. I think the more help they get from a community health worker, that gap is closed. Like, I think the Karenni are probably getting really good care in Milwaukee because Maria always makes sure that she is with them when they go. I don't know about some of the other ones who are like the Burmese tend to be a little bit more willing to do things on their own. They're a little bit more urban. They are like, well, we don't need your help. So I do wonder like what happens to them, like what their experiences are like.
And I think I probably have getting out of my list of questions, but is there anything else, Helen, that you're thinking, I really wish Tobi would have asked me this question?
No, I don't. I just want to say that I think this is an amazing organization. Hats off to my Huamua for building it. I am honored to be taking it from here. And every day I come to work is thrilling because we have this amazing group of people that are really into working with the health of their organization, and I'm really proud to be leading it.
Well, I have always been thrilled with the work and the partnerships that we've had in our interaction, and been so grateful for all the work that you have been doing, Helen. And of course, in the years of knowing my Hua, all that she has done as well. But you've just been such a great asset to the community.
Thank you.
Good. And I think Jai has put up our last slide here. So I want to thank everybody for joining us today. The recording will go out soon to everyone. And if you're interested in connecting with the consortium, you can contact Helen. And if this presentation inspires you, you can scan that link there. Our next presentation, our next spotlight presentation will be in October 23rd, and that will be with Health Connections. The executive director there is Erica Sinclair, and I highly encourage everyone to attend that as well. And thank you, Helen, so much for your time today.
Thank you for having us and wanting to learn more about us.
Well, I hope everyone has a fantastic day.